So I'm Chief Genetic Officer, and I am a co-founder of ThinkGenetic. And ThinkGenetic is designed to use two different methodologies to identify patients at a more earlier stage than you might other. So we're trying to shorten the time to diagnosis and then hopefully down the line, time to treatment. And we're not doing that through genetic testing. We're doing that through the knowledge that we have as genetic counselors and specialists in genetics, and looking at a consumer-focused way of eliciting symptoms and taking people through a guided recognition of maybe they have a particular condition, and then giving them information to open the conversation with their physician. We're also looking at the other approaches, which is going through electronic health records and using very specific signs to opt in and opt out for people being at risk for a genetic condition or possible risk for a genetic condition, which is interesting because our goal on the electronic health record side is to look for signs that people may not be thinking of. And we're able to look in structured data and unstructured data and then provide detailed education to their healthcare providers. So it's almost like a pincher movement. We're trying to help on the patient side, and we're trying to help it on the physician side to support people who may not think about one of these rare diseases and give them very specific information about why they might consider this in their differential down the road. Almost like a physician diagnostic assistant on the electronic health record side. So the great thing about this electronic health record search, we call it Finder, is that we're actually looking at everybody. So nobody has to seek out services. We're contracting with the hospital, the health system, groups of data collectors that then still are able to give information back to the health system. And they look at everybody's records for at least a first pass. And then from that, we've got a very detailed and validated algorithm that we can go through and say, oh, based on this, we're now going to review it with our own manual genetic counselor eyes and see if they do seem like they're high risk for the genetic condition. If they are, then we have a very detailed information sheet that goes back to the healthcare provider from a coordinator within that hospital. So we're not giving information and just hoping it gets taken up. It's actually going from ThinkGenetic's clinical team directly to a healthcare coordinator in that center and then to the healthcare provider. At the same time, we're doing informational educational sessions for everybody within that health system, so it's not a surprise when they get a flag that says, hey, we're just helping you out to figure out if you might consider one of these rare genetic conditions.